If you're in perimenopause and suddenly dealing with low back pain, don't brush it off as aging because in a lot of cases, that's not actually the full story. There are a few common reasons this shows up during perimenopause, and I'm going to walk you through the first things I'd look at. Before we dive in, this is not going to be a discussion about medications, hormone therapy, or weight loss. As a physical therapist, I want to focus on the movement side of things, because that's where I spend most of my time helping women who suddenly find themselves dealing with back pain that seemingly came out of nowhere. One of the most common stories I hear is, I never used to have back pain. I've always been active. I didn't injure myself, and now my back hurts all the time. For many women, it feels like someone flipped a switch. But in reality, these changes are usually happening gradually below the surface. Your body's adapting, your recovery is changing, your strength is changing, your tolerance to stress may be changing, and eventually the low back starts getting your attention. One thing I wish more women understood is that low back pain is often not just a low back problem. The body is a system. The hips influence the back. The thoracic spine influences the back. Your walking pattern influences the back. Even how long you sit throughout the day influences the back. Over time, many women become less mobile through the hips and upper back. When this happens, the low back often starts kicking up the slack. Think of it like a team project. When one team member stops doing their job, someone else has to do the work. The low back is often the body part that does the overtime. And eventually it complains. The second thing I wish women knew is that strength becomes increasingly important. Many women focus on stretching, and stretching can absolutely be helpful. But stretching without strength is often temporary. Your body needs the ability to control movement at the new range of motion. The muscles around the hips, pelvis, and trunk play a huge role in supporting the spine. When those areas become stiff, weaker, or less active, the lower back frequently ends up absorbing more of the stress. This doesn't mean you need intense workouts. It means your body benefits from maintaining mobility and capacity. Another thing I see frequently is frustration around recovery. Women tell me, I can still do the activity, but now I am sore for 3 days afterwards. Or my back doesn't hurt during the walk, it hurts later. This is important. Recovery capacity often changes. This doesn't mean you're broken. It doesn't mean you should stop moving. It means your body may need a more strategic balance between activity and recovery. One of the biggest mistakes I see is women pushing through the pain repeatedly and then wondering why symptoms keep building. Sometimes the answer isn't doing less. It's doing things differently. Now let's talk about something that doesn't get enough attention. Fear. When people experience new pain, especially during perimenopause, it's easy to assume something is wrong with the spine. Many women start avoiding movement. They stop bending, they stop exercising, they stop lifting, and over time, their world gets smaller and smaller. The problem is that avoidance often creates more stiffness, less strength, and less confidence. Pain can change how we move long before actual physical limitations do. That's why education is such an important part of recovery. What would I look at first? If a woman came to me and said, I'm in perimenopause and my back suddenly hurts, these are some of the first things I would evaluate. How much are you moving each day? How is your walking tolerance? How much hip mobility do you have? How much thoracic mobility do you have? Can you control movement through your pelvis, trunk, and core in multiple different ways? How are you recovering from activity? And how much sitting are you doing? Notice that none of these questions are finding the perfect stretch. They're about understanding how the entire system is functioning, because most of the time, low back pain is multifactorial. It is rarely one thing, and it's rarely solved by one exercise. If there's one thing I wish women in perimenopausal knew, it is this. Low back pain is common, but common does not mean normal, and it definitely doesn't mean inevitable. Just because your body is changing doesn't mean pain is something you have to accept. There are opportunities to improve mobility, build strength, increase confidence, and move better. The sooner that you start addressing those factors, the better your chances of staying active and doing the things that you enjoy. If you are ready for change, book your free virtual assessment using the link below. We'll walk through what's driving your pain, discuss the factors that may be contributing to it, and create a clear plan for next steps. You don't have to keep guessing or trying random exercises on the internet. Click the link below and schedule your free assessment. And let's figure out the best next steps for you.